Good day to all of us, especially to organizing committee of the research festival organized by Davao del Norte State College, to our keynote speakers, guests, faculty and staff, program chairs and deans of the institution of Davao del Norte State College, students, co-participants, good day to all of us. So our study is all about a proposed information system in a certain organization. So this is one of our undergrad thesis in the Institute of Computing here in Davao del Norte State College. And it was already presented in our panelists, project sponsor, in a public presentation, and as well as here as one of the lucky participant or entry in the International Research Festival. So before I start my presentation first, so let me introduce our study. So it is a design of health information management systems with real-time digital dashboard for Barangay Mesaoy, Health Station New Corella, Davao del Norte. Yours truly, the project manager, and our co-authors there was our two systems analysts. We have Miss Oclarit and Miss Turing, and our one and only systems designer, Miss Nalzaro. Okay, so without further ado, so let's start the organization overview. So in the organization overview, so our study focuses in a certain organization. So our adopted organization is the Barangay Mesaoy Health Station. So this is located at Purok 1, Mesaoy, New Corella, Davao del Norte. And the local government of New Corella financed the birth of this health station. So presently, right now, the barangay offers health services in the community, as well as to actively giving health services in the barangay. Okay, now let's proceed to the problems encountered. So one of the focus of this study is to identify the problems in the barangay health station, specifically in their transactions and their processes. So there are 4 problems encountered during our environmental scanning. First of it is lack of information when inputting individual treatment record. So as we discovered, there are some missing parts or there are some essential parts there that not updated. Second one is difficulty in health-related report services, such as tallying and summarizing the overall patient consultee for a day. So there are the barangay health station, there are some problems when in terms of overall patients or consultees in a day, and also they have a slower or manual operations and transactions of documents. And third one is the difficult to process and find patients folder because of the reason some of the folders are mixed, unclassified, as well as some other folders or information of individual treatment record are lost. Fourth one is too challenging to manage information because of the absence of the system. So this is one of our challenge that we need to propose an information system in order to the organization to be more effective in terms of giving health services and in terms of giving their important daily transactions. So here in the next slide, it talks about the objectives. So one of the main objective of this study is to design a web-based health information management system for Barangay Mesaoy Health Station. Okay, so one of the innovative feature of this is the real-time digital dashboard. So the main function of the real-time digital dashboard is to integrate the health record information of the different health center location. So the following are the input and process and the output of the proposed information system. Specifically, this will create and update, retrieve health individual treatment records to lessen the workload inputting processes. Second one is calculating and processing an efficient way of health diagnosis, schedule status, and available resources in a month or a year. Third one is to deliver update feature. So another feature of the system is the SMS messaging notification. And the main function of this is to issue prompts and appointments of services offered by the barangay. And fourth one, if given a chance of this proposed information system will be implemented, so the real-time digital dashboard of the system will display and update all the important information and daily consultation in the health center. So since there are four processes or transactions in the health center, so there are namely the general health consultation, the maternal consultation, the child health, nutrition and immunization, and the household consultation. So here is our project development methodology. So one of the methodology that we are going to use is the modified waterfall model. So it is one of the effective water model wherein the waterfall model are identical to the pure waterfall model. So here is a device to respond to from its requirements, design, implementation, verification or testing, deployment, and maintenance. So here are the integrated and proposed new processes in the barangay health station. So as what I've mentioned earlier, that there are four processes or transactions in the barangay health station. So in the first figure, in the left side, so it is the general consultation process. And the second figure is the prenatal consultation process, as well as in the third figure is the child immunization processes. And for the last figure, it's the household consultation processes. So this would be our proposed new processes in the barangay health station. In the next slide, it talks about the work breakdown structure or the WBS for the proposed information system. So this WBS is a format or a guide to the organization as well as the project team to initialize the tasks, deliverables, and the actions of the proposed information system from its planning until up to the closeout of the project. So here we have 5 phases. So here from the systems planning, analysis, design, implementation, and its closeout. So there are different activities or subtasks there in the figure. And here is the budget allocation and schedule of the proposed information system. So we have here the different phases. So what I've mentioned earlier that there are 5 different phases in the proposing of information system. So the plan resource cost, the duration, as well as the schedule. So our schedule when if possible, if the project sponsor will implement this system. So our main target is this system will be implemented in the year of 2024. And this budget allocation could help the organization to allocate or to be resourceful enough to find budget in the proposed information system in the barangay health station. So in the systems planning phase, we have 84,096 in 27 days. For the systems analysis phase, so we have 125,328 pesos in a 52 days. For the systems design phase, we have 58,384 pesos in 30 days. And for the systems implementation phase, we have 74,392 in 45 days. And for the project closeout phase, we have 84,312 in 20 days with a total estimated cost of 426,512 for a planned resource cost. And for its duration, it's 174 days. For the initial total cost of the proposed information system, so we have the different activities. So if there would be an activity, so there would be a resources or costs or expenses in the different activities. So from its hardware, from the software, human resource and support cost, for the travel and meeting costs with a total of 567,245. So for the financial viability of the proposed information system, so from its current process and the proposed processes. So we have here the differences of the current and proposed processes of the different transactions. Here also focuses on the people who work in the barangay health station. So for the BHW and the head nurse, so there would be a differences in terms of their workloads in the barangay health station. If the proposed system will going to be implemented in the barangay, so there would be changes in terms of their workload process. So here is the cost and benefit description of the proposed information system. So as you observe from its personnel, expenses, so from project annual cost, project annual gain, so a total of from its ROI, so we have 10.3%. So that's normal or good ROI for a certain organization. So we will be recommending that if the proposed system will be implemented, so the return of investment is really good. Okay, here for the system's requirements, so functional requirements, the process-oriented, the functional requirements also here, and for the non-functional requirements from its operational, performance, security, and here is the system user interface. So we use a prototyping application, which is Figma, to visualize or to design the Barangay Mesaoy Health Information Management System from the login part, the forget password, the home page, individual treatment record, the patient history, the schedule confirmation, the child health record, the maternal health record, the household and profile consultation record, adding new patient, general consultation, prenatal consultation interface, child immunization interface, household consultation interface, and adding diagnosis and prescription. So here also the patient schedule, the grid view, the patient schedule record, the consulted record, the canceled record, the patient new schedule, the SMS reminder, and the different reports record, consultation performance report, the consultation status report, the diagnosis status report, the consultation type report, and the reports printing. So here is the digital dashboard. So one of the main feature of the system, so the head nurse could visualize all the health related information. Here also the barangay health worker account of the head nurse, the barangay health worker account, and the about the system. Then help interface of the system. So those are the interfaces of the system. So here in the conclusion and recommendation, so in the final analysis, this design will help have the information management system with a real-time digital dashboard that will effectively and efficiently make the barangay health centers actions and decisions in the future. So moreover, the system's real-time digital dashboard and SMS notification features are also significant for determining the numbers of consultation, in generating reports also, and it will be recommended that this study or this proposed information system will be implemented in the organization as well will be applicable into the other local communities that will eventually help the healthcare workers as well as the needs of the patient. So that could be all my presentation. So thank you for listening and watching. Have a great day.